Hi y'all, thanks for joining me today. I promised y'all a while back that I would do a video based off of my chronic conditions so that you could understand those better. The first one I wanted to talk about is Ehlers Danlos Syndrome, or EDS. EDS is a group of actually many connective tissue disorders, all known as EDS. They're all characterized by hypermobility of the joints and skin that stretches more than normal, known as hyperextensibility. And of course, tissue fragility, meaning that it tears easy. They're all considered part of their hypermobility spectrum, and there are 13 different subtypes. Each subtype has a criteria, major and minor, that are used to determine which one you kind of fit into. The doctor tests for these criteria and then matches the patient to the subtype based off of those test results. So all of them also, except for hypermobility EDS, require genetic testing to confirm. And each person with the condition experiences it a little bit differently. So if you have one of the forms of EDS, you may not experience it the same way that I do. So basically today I just want to kind of talk about, in general, what is EDS, how does it affect the body, and how has it affected my body? How have I experienced it? Got some notes today to keep me on track again, guys. So I was classified or diagnosed based off of the Brighton scale and genetic testing as having the form classic Hyper Ehlers Danlos Syndrome. So the major criteria to diagnose this include skin and joint. The skin is basically hypermobile and develops what's called atrophic scarring. And then there's just generalized joint hypermobility. You have to have either both of the major or one of the major and 3 of the 9 different minor criterias. The Brighton scale actually, here, let me put it up for you. The Brighton scale looks at your joints and it determines whether they go too far or not. So for EDS, the first thing they're going to look at is actually your back. So real quick, I'm going to try to stand up here and I'll show you what they're looking for. What most people can do when you come up into a standing position and you're asked to bend over and touch the ground. Most people can get, close. They can do this. With EDS, you're so hypermobile that you can go much, much further. Now, this is without bending your knees. I don't know if you can tell, but my knees are straight during this. Okay? So straight knees, you go down all the way. No problem. No problem. So that's actually a hypermobility of the spine, and it gives you 1 point on the Brighton scale. The other things on the Brighton scale are like your wrists. So let me show you that real quick. If you look right here, your wrist, this tendon is hypermobile on most people that have EDS. So the way to test that is you take your thumb and you pull it down. And if you can go to your wrist all the way, I don't know if you see this from that angle, it's harder if I twist my arm like that, but it goes all the way and past. So that is hypermobile. You should not be able to do that. That is not normal to be able to take your thumb and just, party tricks. Fun. So that's one of them. Another one is the pinky finger. It shouldn't be able to go past a certain point, but with EDS, you can. So you can see that is just very far. And another one on the Brighton scale. Oh, so those are the easy ones to show. The elbow and the knees are a little bit harder. So let's do elbow first. On me, the elbows, some people, when they stretch their arms, it goes backwards or forwards, but you can see, it actually goes sideways a little bit, and it can go more than that. And this is not a trick of the camera. It just does that. And it does that on both elbows, a little bit worse on my left than my right. But it just goes way over. So that's the elbows. Basically, they go beyond where they're supposed to stop. So some people with it, it goes backwards like this, and some people it goes in, and some people it goes sideways like on mine. And knees is kind of the same way. Your knees should be in line with your legs. So if my knees were straight, they would be coming down like this. So you can see that is way off. And a lot of people can, with EDS, when they straighten their legs, mine does to an extent, you can see that it goes forward just a little bit on me. Not as bad on me forward. For me, it's mostly side to side right there when I stand up. So it's a lot worse on a lot of people. But that is what that basically is. So those are the things they look for. To score on the Baton scale and be considered EDS, you have to have a greater than 5. So it's 2 wrists, 2 pinkies, 2 knees, 2 elbows, and 1 spine. All count as 9. And I've put that up on the screen for you. I'm going to put that back up again real quick. And basically, you can see that there's some measurements they use, and if you go beyond a certain point, then you get a point for that. So there are some minor criteria. That's the Baton scale. You have to score greater than 5 on the Baton scale. That's how they test the joint hypermobility. Now, skin, we had said that funny word, hyperextensibility. Now, what this means is that the skin is overly stretchy and just springs right back in place. Not that it sags, but springs right back in place. So on me, you can see. Let's see if I can show this real quick. On my neck is probably the easiest to show, but the skin just stretches too far and I'm already stretching my neck to show you all this, but it just stretches too far. And like on the top of your arms, most people, it doesn't stretch at all, but it comes up and just boom, right back in place. Top of the hand, boom. Okay, so that's skin stretchability, and that is full body. It's not just in like 1 or 2 places. You know, there's going to be some places where it's worse and some places where it's not as bad, but it's pretty much full body. So, atropic scarring. This is basically where you develop a scar that's deep and it doesn't fade. It's a very specific type of scar. The doctor can't identify it. Let me show you one example of an atropic scar, and for me that example is on my stomach. I've had a lot of surgeries, we'll talk about these, but right here, this scar was considered atropic scarring. I have another one further down. I am not going to show you that one. You don't want to see it anyway, promise. So that is how it is diagnosed. Once you get the Baton scale and they determine the major criteria, they start looking at minor criteria. Minor criteria, I've got a list here. There are technically 9 of them, but I found some confusion. Some people say that the 9th one is that a parent or somebody directly, because remember this is genetic, so it's inherited, so you should have a family member very close to you that has the same symptoms, if not already having been diagnosed. But at the same time, other doctors include a mitral valve prolapse. Now on me, I didn't have the mitral valve prolapse. I had a different valve that prolapsed, the bottom one, the tricuspid valve has a slight regurgitation and allows fluids to go backwards a little bit where it shouldn't. It's not so major that I'm going to have a heart attack, but it is something that we're going to have to watch and kind of keep an eye on. So the things that the doctors all agree on as minor criteria: easy bruising. Okay, if you just bump yourself or somebody just grabs your arm and you develop a bruise, that is not normal. That is definitely something on the EDS scale. Soft, velvety skin. Not all the criteria are evil and bad. I always kind of liked my skin. I didn't have a lot of problems with acne. My skin's very soft. I've never really had to use a lot of lotions. In fact, sometimes I have to use some powders to take care of some of the extra moisture, shall we call it. Fragile skin. Now this part kind of sucks. It does go along with the velvety skin and the bruising. Basically, I get cuts like really, really easy. Chewy has jumped on me and just sliced my skin. My dad actually has this symptom as well. He gets cuts very easy. My mom does too, but for different reasons. There's something called pseudotumors, and these are basically just little bumps that pop up. This is one of the few minor criteria that I don't have, thank God. Subcutaneous, up here I can't say that word, but basically I have no idea what this is. I'm going to have to look this one up. Hernia, hiatal hernia is the one I had, and there's other forms of hernias, but hernias are part of the minor criteria. Epicanthic folds is part of it. Frequent sprains and dislocations was like the major one that I pegged. And then again, as we mentioned earlier, technically the chart here says parent who fills criteria, but I have read where a mitral valve prolapse is kind of part of that as well. So those are the official criteria. And then if you get 3 or more of those, they send you for genetic testing. And when they do the genetic testing, they look and see whether or not you qualify based off of what genes are mutated, obviously. And for me, that came up positive, and we found out it came from my dad. So there are other complications with EDS that aren't necessarily listed out there as part of the criteria, but are very, very common for people with EDS. I'm a member of an EDS group or 2 on Facebook. Hi, y'all. It's good to see you. And they can kind of confirm these are very, very common. And my doctor agrees, yes, these are very, very common. So, gastric problems. Remember, EDS is actually created by the protein in the collagen. So, anything that has collagen is affected by EDS. Things that have collagen that we don't think about. Your gums and your teeth that hold your teeth in place are almost pure collagen. So people with EDS, skin stretchy, bones are hypermobile, and your gums aren't as stiff. They don't hold things in place as well. So your teeth tend to be pretty weakly. This does allow stuff to get up between your teeth and your gums, makes your gums bleed very easy when you brush, and pretty much about the only way to get them cleaned out and take care of them is regular deep cleanings. They are painful, and you do have to have them more often. And this is because the gums are lax and allow stuff to get up in between the gums and the teeth easier than on most people. Other things is, and this is a big one, and this is one that I found was probably the hardest one to get my doctors to confer on. And it's taken the last 5 years of study and research in the field, in the scientific community, and experiencing and working with people with EDS for doctors to finally get to where they're saying, yes, this is related to EDS. It's not part of the criteria. It's not part of how we decide if you have EDS, but it is definitely part of it. Your gastric system, pretty much from your tongue to the exit, is almost all collagen. And this is very, very much affected by EDS. And I'd say a very large percentage of EDS people experience gastric problems, both upper and lower. For me, I've experienced upper gastric problems through a condition called gastroparesis. My stomach is actually paralyzed. The testing showed about 70% reduction of function. And it's hard. I'm going to talk more about gastroparesis later, but it's hard to eat. I have to eat very small portions. If I eat large portions, I get full really, really fast. And it's kind of like a Thanksgiving dinner. Every time I eat, I feel like I'm just stuffing myself. And a lot of times, even just a normal plate will make me feel just overly full. I get nauseous a lot and end up throwing up a lot. In fact, that's what had me in bed last time I talked to you on the subject. Lower GI, you can develop diverticulum, you can develop pockets, hernias, as we mentioned before, and prolapses. I actually experienced a prolapse, had to have surgery to get it back in place. That surgery was fairly invasive, but the recovery was pretty quick, and it was like a drastic improvement afterwards. So if you're looking at a hernia or prolapse or something like that, don't hesitate to go to your doctor. What you're dealing with now is much worse than the surgery and the recovery. So just positive note, they can help you with that. Go. The gastroparesis, there are a lot of things they can do to help you. There's medications, there are treatments. Diet change is the number one go-to thing. Just change your diet. And again, I'm going to talk more about it later, but just real quick while I've got you here, there is hope. You can get past this. It's very hard. I'm not going to say it's always going to be great. I'm still not able to hold a job. I'm sick too often, and this is probably the number 2 reason why I can't function on like a full-time job or even a part-time job. I can't guarantee the hours because I don't know when I'm going to be sick. In a lot of ways, I'm just sick too often for that. Vascular. Another thing that EDS affects is vascular. A lot of people with EDS have problems with their veins. For me, my veins roll, which means that they move out of the way when people try to put an IV in it. Makes it very difficult for them to give me rehydration or medication or do anything with me in the hospital that requires running an IV, because my veins blow up really, really easy if they do get the IV in. So ultimately, I ended up having to have a Mediport put in. This is a device that gives them vascular access in a stable vein that doesn't rupture. If you have frequent hospital visits and your veins are junk, they can't get a vein to stay, they can't get the IV in the vein, they rupture, they just won't hold an IV, you might want to talk to your doctor about something called a Mediport. A Mediport is a wonderful device. It does provide that stable vascular access so you can get the medication you need in a timely manner without blowing up every vein in your arm. There's been times I've gone to the ER and they try to one here and one here and one up here and one over here and one in the hands, and I've even had them in my feet and then blow up. I had left the hospital one time and it looked like my arms had been through a dryer. I mean, just bad, just totally beat up. Like somebody had just taken a hammer and just beat my arms to death. And I'm black and blue from the wrist to the shoulder. Absolutely not even exaggerating. And it was all from IVs that had blown up. That's why ultimately I talked to my doctor. I says, please, there's got to be a solution. I can't do this anymore. And they ended up putting in the Mediport, and that's been a huge blessing. I've used it about 5 or 6 times. Now, the vascular, some doctors do agree with this, and some say that it's not vascular, that it's just stress related. Either way, anxiety can affect your mental health, whether it's because veins are weak and swelling and putting pressure on the brain, or whether it's because you, especially with vascular EDS, you're subject to aneurysms, which is where the blood vessels actually rupture in the brain and cause pressure in the brain through brain bleeding. Luckily, I haven't had any aneurysms or anything like that yet. I'm hoping I don't. But even in classic EDS, it does affect the vascular system, so that is a risk and something you'll definitely need to talk to your cardiologist about. It also, as we mentioned, affects the valves in the heart. So the most common one is the mitochondrial valve. Mine, it's the tricuspid valve. But basically, the valve is weak. It doesn't seal off properly, and it allows blood to go the wrong direction. So another thing is the cushioning in your joints. Now, we mentioned joint hypermobility, but if you think about it, basically what it is the collagen in those joints allows them to stretch too far, but it also allows them to slide back and forth a lot and to squish in, and you know, you're just doing this constant stretch, pull, twist, stretch. It's a mess, and it's really, really hard on your joints. So whether it's directly causes it or just causes it over time, what I found was that my EDS did ultimately lead to spinal degeneration and a lot of osteoarthritis in my joints. It causes a lot of pain in my shoulders, a lot of pain in my hips, a lot of pain in weird places. Did you know that your ribs can actually dislocate and separate and move out of position? Yeah, your breastbone right here, your ribs are connected to that. Ribs in the back. That was the part that really surprised me the most. There's little bones in your ears that can actually separate and cause pain and get out of place. Your jaw, the mandible, can actually separate and be kind of tweaked just a little bit. I've had it to where it was over too far one direction or backward, forward too far. You can see what's called an OMM specialist, Osteo-Manipulative Management. Osteo-Manipulative Management doctors are physicians that help use joints, like kind of similar to a chiropractor, but more than just the spine, like shoulders, hips, knees, everything. And they help realign it using pressure points and tension, and just different techniques to kind of put everything back in place and help realign you. They can work on your ears, they can work on your jaw, they can work on your neck, they can work on your shoulders, all the way down your spine. They can help with the ribs and getting all of those realigned. They can help with your hips, they can help with your knees, they can help with your ankles, just literally head to toe, help you get everything back into place. So that's all my notes. The other things, there's just a couple other things I wanted to show you. These are really more just for fun, but hypermobility, how it affects, and some cool party tricks. So hips, when I walk, I wanted to show you when I walk, it's actually in the SI joint. So the SI joint is back here. It's actually a cluster of joints that goes along the lower spine. And in me, this joint actually shifts left or right as I'm walking too far. So real quick, I'm going to show you when I walk. Ooh, I can catch my balance real quick. It shifts right in here. And it felt for the longest time, I thought that my hip was actually coming out of place. But we did some x-rays because I can actually stand here and make it do this. And you can see right there's the joint. So in and out. But when I'm walking, as I got older and the muscles went away from limb-girdle muscular dystrophy, it got to where it was harder to control this. So instead of just being able to just do it on my own, now it comes out as I'm walking, it shifts. And that's not something I can really control. Other things that it did, and this is something I've always been just very, very flexible. I showed you some of the other things, but going back and over the shoulders, my hips do go too far backwards. And I don't know if you can see this, but they're going way past the normal. Most people can come up to their chest right here. That's normal. Some people, if they really do like a lot of yoga and stuff, can go back. But I've never done yoga in my life. This is just straight. And I can actually get it to go considerably further back if I want to, but I don't want to actually tear something. As you get older, EDS affects you a little bit differently. So when you're younger, EDS affects you because you're too hypermobile. But as you get older and you get to where you can't move as much, things do stiffen up. And those same joints that were hypermobile become hypomobile, the opposite. They get to where they're too stiff. Now, in most people, this just means, oh, well, I can't go as far. I can't move as much because I'm getting older and I'm getting stiffer, and that's kind of normal to an extent. But with EDS, because of the things tear really easy. Those muscles aren't just flexible. Those tendons are fragile. They tear real easy. In fact, if you'll remember, one of the minor criteria was easy sprains, easy ligament tears, easy, you get the idea. So as you get older, this becomes more of a problem. The other things that progressively get worse as you get older are those valves, those heart valves. It's very, very important to see a cardiologist and monitor that. See if you've got that prolapse. See if you've got some regurgitation going on there. And monitor it and make sure it's not getting too much worse. There are things that they could do to kind of help with that if it gets beyond a critical point. So next time we come in here, I want to talk about limb-girdle muscular dystrophy. I have classic EDS and limb-girdle muscular dystrophy type 2J, also known as Titanopathy. And it plays in with EDS a lot. In fact, it was really, really hard for a while to distinguish what was EDS and what was muscular dystrophy and which was doing what to my body. So I hope this kind of helps explain EDS a little bit better, explains how it affects. Dislocations are probably your biggest concern with EDS. My shoulders come out of place. My SI joint makes it hard to walk. I've had spinal fusions. The gastric problems, most EDS people that have the gastric problems find those to be extremely disruptive in their life. There are things that you can do to overcome that, primarily diet change. We'll talk more about the gastric problems later. For EDS, the prognosis for the future. You notice my wheelchair. I am in a wheelchair, but that is because I have a combination of conditions. If you have EDS, some EDS people end up in wheelchairs because the sprains and the pain in their joints is too much and they can't handle it, and they don't feel comfortable walking anymore, so they move over to a wheelchair. Most people with EDS do end up using a cane. It helps provide the stability for their knees that their knees and their ankles aren't providing, and helps re-encourage their balance. But you're not necessarily doomed to a wheelchair. I didn't have this wheelchair until about 3 years ago, maybe going on 4 now. I am 40, let me not lie, I'm 42 years old. And I was about 38, 39 before I actually needed the wheelchair. The reason for me is the SI joint and the others. You can overcome joint instability through muscle tone. I was able to do this in my early 20s, in high school, towards the end of high school, through muscle and weight training. But ultimately, unless you manage to maintain that muscle tone your entire life, unlikely for most of us, you're going to ultimately have some of that instability, some of that wobbliness, and you're going to need a cane or something to help keep you safe so that you're not spraining your knees and spraining your ankles or tearing up your SI joint every time you take a step. For me, the limb-girdle muscular dystrophy took away that ability to have that muscle tone, and as a result, the joints just got more and more wobbly, and I ended up in the wheelchair. The gastroparesis, I ended up with a gastric neurostimulator. I have had feeding tubes to try to overcome it. That was pretty miserable. I have a hiatal sliding hernia. That's most likely a result of the EDS. And I have constant bruising. We've talked about the vascular complications. I ended up having to have the Mediport to give the doctors a way to give me medicine without making things worse. And I'm trying to remember if there's anything else EDS specific. It can affect your hearing. I actually have hypersensitive hearing. So basically what this is the eardrum is just so flexible that it responds to the least little sound. As you get older, this does stiffen up and get to where you don't hear as good. So it goes the opposite direction. And I have heard of EDS causing eye problems. There's a lot of collagen in your eyes as well. So I used to wear glasses. I actually need to go in. Y'all may see me in glasses again here pretty soon. But I had LASIK that was able to fix it. I had about 5 years where I didn't need glasses after the LASIK. And I'm just now getting to where it's getting hard to read stuff, and I'm probably going to have to go back and get glasses as well. Other things about EDS. Pregnancy. I do remember I actually ended up ultimately having a hysterectomy, but EDS can affect reproductive. Your reproductive system, ladies, is, and again, I'm talking to the ladies here, sorry guys, but EDS does affect your reproductive system. The reproductive system is mostly collagen, and it's definitely affected. For me, I had cysts that would form and rupture and bleed internally, and then it was just very, everything is, on a positive note, they say it's easier for us to bear children, but we are susceptible to having tears and stuff in the uterus and some things like that. So those are always important if you're trying to have a baby, if you're having a baby, if you're pregnant. It's really important to talk to your gynecologist about your EDS and how it might be affecting your uterus and the birth canal for when the baby comes out. I experienced some tearing when my babies were born. I delivered naturally for both of my children, and I did experience some tearing down there that they ended up having to do an episiotomy to sew up, and that has probably contributed to the prolapse, the colonic prolapse that I experienced, and some weakening of the Kegel muscles. I've tried doing Kegel exercises, but unfortunately that's something that's being affected, I think, by the limb-girdle muscular dystrophy. So next time we're here, we'll talk about the muscular dystrophy and how it affects the body. And then the next time after that, we'll talk about how they've kind of worked together. I think you've probably already got some insight onto how they work together a little bit. So I almost forgot to mention one. There is one other thing that EDS has probably caused, and that is called Posteo-Orthostatic Taci-Cardia syndrome. This is where your blood pressure doesn't compensate for positional changes. So when you stand up, you get very, very dizzy, very lightheaded, and the world kind of fades out for a while. This is also very, very common with EDS. Hope this video wasn't too long. I hope it helped you understand Ehlers Danlos Syndrome much, much better, at least the classical version. And I hope this gives you some insight as to what you can look for if you have EDS, and know some of the things that you can do to help counter those. So thanks for joining me. And if you want to get that video on limb-girdle muscular dystrophy, the combination of the two, and the other chronic conditions, including gastroparesis, if I can talk today, including gastroparesis, then you will need to go ahead and subscribe. I need you to hit that notification bell so that you get that notification right away. And if you've liked this video, please give me a thumbs up. I really hope it was helpful. And be sure to share it with other people that you know that might need help understanding this truly challenging condition. Thanks for your time, y'all.